the forefront of the biggest calamity of our nation, the COVID crisis, being part of the National Task Force Against COVID. But only the third surgeon health secretary. For our younger surgeons, you know what to take up for you to become a health secretary of the future. We have only 3. And other specialties start with the letter D. So our first health secretary, who is a surgeon, was a thoracocardiovascular surgeon, Dr. Garcia. And our honoree this afternoon is a transplant surgeon, Dr. Ona. And of course, our speaker this afternoon, no other than a trauma surgeon. May we welcome our Secretary of Health, Dr. Teodoro J. Ona for the kind honor, and of course to our President Juvi for thinking of this particular honor to Enrique Ona, and also to the one who introduced me. Ronnie DeVitas was my first year resident when I was 4th year, and we were operating for 5 days for all trauma cases because on New Year's Eve, the other hospitals used to close. They all sent them to PGH and the Metro Manila, and we would operate all the gunshot wounds, stab wounds, fireworks injuries. And if it was your service that was on duty on 31st, all the cases are your cases until you finish them. So Ragasa and I, Ragasa was my chief, we were operating alternately for 5 days. We always sleep in between days. The rest of the team quit. Third honor, Dr. Enrique Ona Jr. He's actually the 28th Secretary of Health. As you heard, I am the 30th. And as you also heard, we have only 3 surgeons that have led the health department in its entire history. And we do hope that this series of talks and orations from Enrique Ona would inspire younger surgeons to take up the interest in health policy formulation and health leadership. I was very lucky to serve Enrique Ona. He plucked me out of the operating room. In fact, I was resistant to be his undersecretary. I asked him to give me a week. I was actually doing a surgical mission with the whole team in Zamboanga, Sibugay. And I thought for a whole week if I was going to accept that. Until in the final end, we were doing the mission with the Catholic Church. So at the Bishop's Palace, I think George Concepcion was with me at that time. The sermon of the priest was something about that part of the Bible that asks you to come and serve. So that you are my army. So I ended up saying yes to him, and it actually changed my whole life. I'd like to honor, of course, in the picture you showed the boss, Secretary Ona, Dr. Norma Ona. Thank you very much for joining, Secretary Ona. This story because not many people know the impact of what Secretary Ona did to the health sector. And I'm quality care. In fact, it had improved it so bad. It improved it so well that now you have long queues of people lining up for low-cost CT scan, MRI, operations of high-end surgery in these public hospitals. Legislative measures that were passed in the time of Secretary Ona that affects us even today. The first is the Tobacco and Alcohol Excise Reform Act. Because of this, as Secretary of Health, I am running an agency that has the 3rd highest budget in the land. We are topped only by the Department of Education and the Department of Public Works. I am tasked to run a department that has plenty of funds to actually put time. We only got 10. 5 disappeared. 5 of our votes Luckily, there was one senator, and I can state that now in a public oration. There was a senator that we counted anti-syntax. He was usually a mentee of the president at that time, Senate President Enrique. Alam niyo kung sino? The actor, Lito Lapid. So Lito Lapid switched and turned to syntax. And because of that, we won the vote 10-9. 19 people, 6 people were absent. So actually, because of that, I voted for him in the last election. Why did I do that? High school graduate. Sometimes we think people that in the Senate should be lawyers and nationalists. But I think sometimes we need people that understood, that had a heart. Because I think he did not decide based on the fact that Enrique was from the north in the tobacco growing belt. He listened to what we were pushing for, which is health and taxation. And because of that, we got the syntax. 600 people, which we counted pro, left us. But I'll tell the story later because there are some stories attached to that. We will be declared high middle income country. But that's also correct in their statement because that's a national average. If you go to different islands, we have islands that are low income and even lower than some of the countries in Africa. So the national picture does not give a very focused picture of our national. So yes, if you go to Metro Manila, you go to BGC, you can even label us as high income country because some of the foreigners don't even see stuff like that in their own countries. But on the average, we are actually low middle. But the effect of increasing the money and put the money in the bank. So that 89.9, don't believe your fellow doctors. They don't understand what the hell is happening. What is really happening is money that should be paid for your reimbursement as a surgeon is being kept in the bank. That's why Secretary Ona, Rector and I took that money and paid it for health emergency allowance. That's why many of you in the private sector received 6-figure checks for the work you did during the time of COVID. So pwede ba, huwag kayong sumunod sa mga kumukontra doon because they want us to give back the money to PhilHealth and PhilHealth will just put it in the bank as reserve, as investment. That's not what we want. We want them to pay the health benefits of its members. So Ona was also able to make sure that the syntax paid for the premiums of the poorest. Dati kasi LGU nagbabayad. The time of Secretary Ona, he made sure that the national government would pay for the premiums of the poor. When it was the local government, it was only paid during an election year. After the election year, hindi na binabayaran. So they would get to the hospital, they have no health insurance because the premium was unpaid. That was fixed by Secretary Ona at that time. To have the assurance that wherever they go to sleep or wake up, everything will be all right as far as health is a concern. So the idea was financial risk protection, making sure he targeted the poorest. And he's successful because we were able to target the 5th quintile. Today, we actually have universal health coverage only for the poorest. So if you're a poor Filipino, you can get open heart surgery for free, you can get neurosurgery for free, you can have a congenital operation, and everything is at no balance really if you are an indigent. But if the moment you say we have employment, you have copay. And that's my struggle now. My struggle now is how do I deliver universal healthcare to the working middle class, which is the human capital of this country, who is the one paying premiums. Kasi yung premium ng poor, kinuha natin sa sigarilyo at tobacco. And I was tasked to actually head the center that he established. And then we had an office at the NKTI. And we were recognized by UNESCO because NKTI had the largest PPP for dialysis machine. I think at that time there were 30 machines in one place, and it was PhilHealth was self-sustaining and paying. Because of that, nobody in government buys dialysis machine. We always partner with the sector, and this changed the way our hospitals. We were invested in building the hospitals, and we were hoping that the equipment and the diagnostics and the imaging would go for PPP. Unfortunately, yung sumunod sa amin, hindi naintindihan yung ginagawa. Secretary Ona pushed, and people don't know this. NKTI was the first ISO certified public hospital. And that's a push for quality. And during the time he was secretary, he pushed for ISO certification. So Rayda Lupando was and she was a world-renowned family medicine specialist. And we developed family and community medicine residency in all the hospitals. In fact, I tried to go back to medical school teaching this when I returned after becoming an undersecretary. And I tried to teach what I learned to the medical students. But the medical students weren't interested. They wanted to learn how to insert a Foley catheter, how to do a surgical procedure. They weren't interested in health financing. This is another attempt. When the PCS decided to form the UHC, technical working group, suddenly the discussions were very lively. We would talk to wee hours of the morning, in the evening, late in the evening, discussing how UHC would affect surgical practice. So I think surgeons will be interested because we are reforming the health system, and what we're practicing today may definitely change because of the changes we're doing. Well, progress in the healthcare system is a continuous process, and actually that's what I'm doing. So we were called by my fraternity brothers, we are fraternity brothers. My fraternity brothers called us the Batman and Robin of the Philippine healthcare system at that time. I don't understand that because Robin never became Batman. He was always Robin, never. And Alfred too. So in 2019, we passed the UHC Act, February. And in October 1010, we passed the implementing rules and regulations. A huge law with lots of things that were inputted into it, very facilities, which was actually decimated because of the devolution. Remember, in 1992, we gave provincial. So I think they didn't understand that that had unintended consequences on hospitals being closed, mom and pop hospitals selling to bigger conglomerates, to keep people well and prevent disease through vaccination, keep people well through diet and exercise. Sabi ko nga, Ted, tamang pagkain, ehersisyo, at disiplina sa katawan. The second thing is close to my heart, which is acute care. If you have an emergency, you cannot go to a big hospital because they will make you wait if you're not dying. They will triage you to the category that you will wait for hours. So the hospital, the big hospital, is not the place for acute care. It's the place for emergent dying patients. So I said, acute care must be delivered in urgent care centers. And the third one I thought about as a pillar to make sure primary care happened was the people who take care of us, the women. So not only do you have healthcare workers, you also have health care providers. Your wives will actually tell you to eat less, to exercise, and to have that executive checkup. It is the women that brings the children for immunization. It is the women that brings the children for vaccination. So I think, and when you ask the women, who's taking care of you? Number one cancer in women, breast cancer. We're treating breast cancer the wrong way. We give it up to the oncologist. So the Department of Health has 1 billion pesos on cancer assistance fund. But how do you treat breast cancer, guys? It's early detection, mammography for the people. Where are the mammograms? Where's the early detection? Where's the early surgery? Where's the early diagnosis? We should shift our spending for that. Do not give up cancer care to the oncologist. You should lead it as surgeons. Tama na pa kayo kasi iniwan niyo yun eh. So what did we do? So I found supplies on the supply side, primary care facilities. The private sector is also growing. So we have a partnership. In fact, the private sector is growing faster than the government. It's now providing 54% of the health. 3.6 billion. Dr. Norma Ona requested me for a hematology center there. I said, Ma'am, okay na ba yung 3 floors? And then negotiate siya, gusto niya 4 floors. I'll see and find out after my talk if she's happy. But definitely, we are putting, in fact, one of the things that's going to be put in this legacy project is proton beam therapy. So, you're saying, wow, Singapore has 3, right? Singapore has 3 proton beam therapy. They want us to go to Singapore. I want to compete with Dr. Teo of Singapore. I want to get the patients here because it's costly to fly there. So don't worry, you'll still get the rich patients. We'll take care of our poor patients so we don't have to send them to Singapore. This is the other legacy projects in Bicol. This is a 10-story medical facility. These are all ongoing. If you go to Bicol in Legazpi, this is under construction actually. This is 3.5 billion pesos. This is ongoing, 20-story, really expanding our healthcare space. And this is the big flagship project of the President. This is the 57-hectare, which replicates the North Triangle of Quezon City with Heart Center, Kidney Center, Lung Center. This is already ongoing as well. The first 3 buildings are under construction, 1 billion each. And we're still getting 2 other buildings. I think this is coming from a grant from the United Arab Emirates recently. So we may get the Heart Center, the Kidney Center, the Children's Center, the Cancer Center, all working. And the 4th building, which is the Medical Arts Building, which is already under construction. Ganda, no? Sayang din ako nagpa-practice. So, as we can see, DOH strategic focus is primary care, but we have not forgotten specialty care because it is a systems approach. We have to look at system strengthening. Urgent services center. Sabi nila bago. Eh pag 3 years ka na dyan, anong tawag? Better, di ba? Better urgent care and ambulatory services center. This is a ChatGPT image. Don't worry, I'm just making you salivate. But this is the real one. This is the very first one we opened on March 6. This was a TTMF facility, a 25-bed community hospital in Santo Tomas, Pampanga, that were in the 4th class municipality, couldn't run it. So they donated it to the Department of Health. So I said, remove the beds, let's convert this into a bagong urgent care and ambulatory services center. So it's run through J.B. Lingan. The director of J.B. Lingan run it. I brought this director to Singapore. And I made them visit the newest polyclinic. What place is that where all the ministers live? The one with the hospital that also has a environment friendly. Anyway, this polyclinic, I showed them how the Singaporeans were able to convert polyclinics as part of their access to care. And we copied it. We copied this. I unabashedly copied it and Filipinized it for local health care. I targeted, in January of this year, I told the DOH, I want 28 bukas centers for the 28 million poorest Filipinos by 2028. 9 months later, I have 39. Ayos ba? I have 39 of all of these facilities and they're working in different parts of the country. This is the Bagong Pilipinas mobile primary care clinic. That's also a ChatGPT image. This is how it really looks like. It's got all the laboratory in it, vaccine refrigerator, generator set, and also X-ray, ultrasound, eye equipment. But this is given to governors, and governors are supposed to run away with primary care. So I'm now stopping all this funding of primary care clinics that doesn't have staff anyway. And we can run it through the provincial governors' personnel in the provincial hospital, which is the same model as my bukas. So you can replicate my bukas, but now in the mobile area. So you can see what I'm trying to do. I'm increasing the network of healthcare. Then there's Purok Kalusugan, the last mile. My idea is that population health can be delivered through Purok Kalusugan directly by members of the Department of Health. Not the local officials alone, but the members of the Department of Health in collaboration with the barangay health workers. My hope, during the time of Secretary Ona, we had wanted to take back all the doctors under the Department of Health. Pero napakamahal, Secretary Ona. Remember, we computed the cost of the salary. I have a better solution now, but I will give that solution only after the May elections. There are only 250,000 barangay health workers in the country. If I give them a certification course from TESTA, I can hire them salary grade 1 at 11,000 a month. They're now paid as volunteers, 1,500. Kinukuha pa ng barangay captain yung 500. Tapos yung mayor kinuha pa yata yung another 500. So wala nang natira. So my idea is to eventually run this kalusugan under the army of barangay health workers. Kasi ang nangyayari po, every time there's an election, the barangay health workers are fired. And we invest training in them. So the idea here is to have them, give them security of tenure. Lastly, so this is the Kalusugan, and I think all my population health projects, from immunization, maternal and child program, nutrition, water sanitation and hygiene, TB and HIV control programs. Ladies and gentlemen, just because of the mentoring of Secretary Enrique Ona, I'm able to have direction at the Department of Health. Many people are approaching me saying, you're doing the right thing. I hope so. That's what I think where we can bring healthcare to. I hope my Philippine College of Surgeons will help me. The first thing I asked the Philippine College of Surgeons to do when I became Secretary of Health, I asked Juvie, make me a national surgical plan. And they've actually come up with it. So congratulations to all of you. Maraming salamat. Mabuhay. Sa bagong Pilipinas, bawat buhay, mahalaga.
Actually, the President right now is distributing a copy of the National Surgical Plan made by the Philippine College of Surgeons and presented to the Secretary of Health.
Thank you, Dr. Herbosa, Secretary of Health, for a recollection of the journey and memory, through memory lane. Today, we live in a world with many forms of injustice. But as Martin Luther King Jr. once said, of all forms of inequality, injustice on the earth is the most shocking and the most inhumane. This existential threat to parity threatens to undermine the health and well-being of individuals and populations and represents a formidable obstacle to development. Which is why I believe that health should always be regarded as an investment, especially in the ever-evolving crisis of healthcare, and cope with the ensuing demands it exacts on both patients and health workers. As surgeons, we have invested in the noble calling of saving lives. Thus, we must be able to find within ourselves the willingness to go beyond and above the call of duty, not just by pursuing. Then, as a Secretary of Health, naghahanap ako noon ng Undersecretary. And si Ted noon was already, or I had accepted already and spent a couple of times as a consultant at the University of Malaysia in Kuala Lumpur. Tinawag ko sa kanya, Ted, ito pag ginagawa mo dyan. Marami tayong problema dito, tulungan mo ako. And of course, it did not need much cajoling. And finally agreed. And to me, that is history. My gratitude also goes to the leadership of the college and the leadership of this gives me added motivation to be more engaged in matters concerning health policy and reform, which I hope and I'm quite sure the future leaders of the college will actively pursue in the years to come. As I gaze upon the youthful faces of our new colleagues in this audience, especially this morning, I am filled with optimism and hope, knowing that the future of the Philippine College of Surgery is secure. Because I believe that no predicament is too great for individuals.
Upang ma-improve ang ating health delivery system. Ang PMA ay kasama ng lahat. Tayo po'y magkaisang maghatid ng kalusugan para sa lahat. Magandang hapon sa inyo.
In this oration, and thank you very much, Secretary Ted, for being the first Enrique Ona Orator. Magandang hapon po sa inyo.
Nabati ko ang YouTube channel ng Doc Rolly. Kasama namin dito sa Philippine College of Surgeons. Kamusta kayo dyan? Whatever.
Thank you, sir.